Good morning, everyone. Welcome. I'm Dave Roth. Thank you for giving your time to this meeting of the Health Equity and Access Response Team for COVID-19. We have some new members with us this morning, and I want to give all of you a heads up. And in a couple of minutes, I'll invite you to turn on your microphone and share with us your name, your affiliation, and then what brings you to this health equity table. In the meantime, I want to remind everyone that this is a Zoom meeting that's being live streamed to the public. As we are building a team and being transparent at once, we have a couple of requests. One, the recording allows this to be posted on YouTube. So you can forward that information to your colleagues. You can go back to that YouTube recording to better understand what happened at the meeting. So even those members who are not here can stay connected to us. Please be aware of background noises and mute yourself when not talking. We are building a team, and this team is getting stronger and stronger each time we meet. During discussion times, I encourage you to keep your video on as much as you're comfortable to help us continue to get to know each other. A reminder that HEART is the team that leverages our diversity to create new solutions, so that as we respond to COVID-19, the entire community achieves optimal health and no one is disadvantaged. We are the team that extends our solutions beyond public health professionals so that our businesses, our governments, civic associations, human services providers, and others join with healthcare to change our habits and ways of doing business so that everyone gets to have the best health possible. Finally, we use data, the best available to us, disaggregated by race, origin, and other relevant identities to understand the harm that's been done, to make strategy, to take actions, and to measure progress. This morning, we have 5 things that we're going to do. We're going to welcome new members who are with us. We're going to reflect for a little bit about the new Census 2020 data that's becoming available to us and think about what are the implications for our work in health equity. We're going to get an update on focus groups regarding COVID-19 vaccine confidence. We're going to look at planning for health equity in the county's overall health development health plan. Nicole and Kara will carry us through that process, and Mila as well. Finally, we'll get an update on COVID-19 in the county, and that will bring us to a close. So welcome to the meeting. And I want to ask those of you who are with us for the first time, if you don't mind self-identifying, turning off your microphone and introducing yourself, your name, your affiliation, and what brings you to the table.
Good morning.
Hello. Go ahead.
Hi, Maya. Okay. I'm Jen Laddish Douglas. I'm an attorney with over 20 years of experience in real estate and housing. I also do litigation. And I'm here today because I have gotten involved in advocacy. I'm a patient, and so I bring a patient perspective to the group. I've been a type 1 diabetic for almost 30 years. I'm a breast cancer survivor, and I have a child with special needs. And a few years ago, I started getting involved in legislative advocacy. So I work with the legislature to write and lobby for changes to healthcare, and have been successful. So I'm very excited about it because I love seeing better for the people of our county and our state. And I'm very excited about helping out. I'm on the NAACP Health Committee. I work with the JDRF and the ADA and a lot of other health groups to work on this. And I really appreciate the invitation to join you and to help out. Thank you.
Welcome, Jen.
All right. Hello, everyone. My name is Maya Gamble. I am a Community Impact Director with the American Heart Association. And my reason for being here today is kind of to just sit back and listen and see what you all are doing and see what opportunities there are for AHA to assist in your efforts.
Welcome, Maya.
Hi, I'm Katie Danilowitz. I'm the new Immigrant Support Coordinator at Catholic Charities. And I'm here, just like Maya, just to listen and learn, and also just because I feel like vaccine hesitancy is a really big issue affecting not only the entire country, but also the immigrant community.
Welcome, Katie. Are there other new members with us today? Anyone that we have not yet heard from who's new to the group today? All righty. Well, to the new members who are here to listen and learn, I do want to encourage you that your experience in responding to COVID already makes you a relevant voice at this table. And as we get into our discussions and issues today, we welcome your input. Thanks.
Dave, could I make a request? We don't typically do this at every meeting, and for good reason, it takes a long time. I just wonder if, since it's been so long since we've done group introductions, we could very briefly just indicate the name and the organization that we represent, because we have enough new folks that have just been here for a few meetings that they may not know where everyone else is coming from, and that might be good context.
Absolutely. I see a lot of eyes widening at the prospect of that. And for some of us, it will help us get to know each other better, even if we've seen those faces. So let's do that. And I think the way what I'll do is just work across my screen and invite you and to introduce yourself. I'm Dave Roth. I'm Executive Director of Dupage Federation on Human Services Reform. We're a planning council for human services. And for us, it is essential that human services be vital participants in the response and recovery to COVID. And we're convinced that it can't go well without that. And then I want to ask Kara, Evan, and Julieta to please introduce yourselves.
Hi there, everybody. Kara Murphy, President of the DuPage Health Coalition. Typically, prominently, we coordinate health access for low-income, uninsured, and underinsured residents of the community. Thank you.
Thanks, Kara. I'm Evan. I'm the village manager for the village of Bensonville. So we've been particularly hard hit in DuPage County by the pandemic, and have appreciated my time with Heart since the get-go. Thank you.
My name is Julieta Alcántar Garcia. I am here from Immigrant Solidarity DuPage in Wheaton. I am a community health worker and an immigrant rights advocate.
And I'm going to ask Mimi and Asma and Jan to introduce yourselves.
Good morning, everybody. My name is Mimi Dahl. I work with Condeo Consulting, and we consult on health, education, and social service issues, particularly around health equity and social determinants of health. Happy to be here.
Good morning, everyone. I'm also happy to be here. My name is Esma Jarad, and I work with the Islamic Circle of North America in Glendale Heights and the Chicago area. And communications department, we work with refugees, immigrants, low-income families, and our focus is for family wellness and for any neighbor in need.
Good morning, I'm Jan Geider. I work across the county helping to build and sustain collaboratives in the interest of improving health outcomes, and with a special interest in equity and health, which is why I recently began a nonprofit Equity and Health Advisors Network, believing that there is so much more I can do to bring health equity to our community.
Thank you, Jan. So now I invite Lynn and Adam and Amanda.
Good morning, everyone. I'm Lynn LaPlante, and I am on the DuPage County Board in District 4. And I love being here. I love this group, and it's always good to see everyone's faces.
Hey everyone, this is Adam Forker from the DuPage County Health Department. I'm the Director of Client Access here, and being part of the Health Department team, we're We're very involved and interested in all of the things associated with the pandemic response, and doing that and more better and equitably is something we're always interested in learning. And so I'm happy to be a part of this group.
Hi, I'm Amanda Nani, and I am with World Relief Chicagoland, and I oversee our family case management department in our DuPage office. And part of that is our program that has community health navigators in both the DuPage and Aurora locations.
Hey, Dave. I'm sorry, I wanted to mention that I do have a new student from UIC doing her field work this fall with us at the health department, and I asked her to join in and listen in the call. It's actually her very first day. So that is Saba Siddiqui that you see below listening in, and she's going to be with us through December.
Excellent. Welcome, Saba. So now I want to invite Dr. Asfar and Mary and Jackie to introduce yourselves.
Hello, everyone. I am with Asma Gerard's organization, Islamic Circle of North America Relief. We have a nationwide network of transitional housing, food pantries, health clinics, skill building development program, disaster relief services, refugee services. We serve 15 plus nationalities. Our staff speak 8 plus languages. And we are so happy to be here. Thank you for giving us opportunity. I'm the Midwest Director in ICNA Relief.
Good morning, I'm Mary Keating. I'm Director of Community Services for DuPage County. We are the Social Work and Grants Management Wing of county government. We manage a number of state and federally funded programs, most of which, probably all of which, require us to make sure that we're reaching into the communities most impacted by the pandemic. And so for that reason, I really appreciate this group. Thank you.
Good morning, everybody. I am also in doing my fieldwork class. I have been interning with DuPage Federation for the past few months.
Thanks, Jackie. And now I want to invite Karen and Rushmi and Penny to introduce yourselves.
Hi, I'm Karen Ayala. I'm the Executive Director here at the DuPage County Health Department. I am so very grateful for all of you to be a part of this effort. Clearly, health disparities is something that looks very different in DuPage County than it does in other parts of even the region. And a lot of times when you look at DuPage County, you think there are no needs, right? And I think it's really vital to take the lessons that we were afforded actually dumped upon us by COVID, and really use them as an impetus as we move this work forward. So yeah, very grateful to have the support of so many community leaders on this group, and feel like it's a vitally important for public health to be providing the level of support to this group so we can get some real traction.
Good morning, I'm Rushmi Chugh, and I have the privilege of serving as medical officer at the DuPage County Health Department. My background is I'm board certified in family medicine and had practiced clinically, and then have been serving in this role since 2003. And the past year and a half, of course, have been like no other time. And so appreciate the strength in our diversity and just the togetherness of our response, within the health department and through the partnerships within our community. So thank you. Really appreciate everyone's participation and advocacy here. Thank you.
And the woman behind the screen, Penny, are you available to reintroduce yourself?
Yes, my name's Penny Chanas. I'm Karen's executive assistant, and I serve as just supporting all of you on this very important work that you do.
Thanks, Penny. And then I want to invite Mila and Nicole and Sarah. And then Saba, if you'd like to introduce yourself, you're welcome to also, but we'll start with Mila.
Good morning, everyone. My name is Mila Sagalis. I work with the DuPage County Health Department team here. I have the pleasure of working with our community resources area, which involves a lot of our prevention work, our coalition work, and also our very important population health work that we're going to talk about today. So thank you for allowing me to join you in this work over the past 8 months or so, and I'm looking forward to today's discussion.
Good morning, everyone. I apologize. I don't have my camera on. I'm actually driving right now. But Nicole Edmonds, I'm the Central Chicagoland Regional Director for Community Health for Advocate Aurora Health. So I oversee the Community Health Department for Good Samaritan Hospital in Downers Grove, Illinois Masonic Medical Center, which is in Chicago, and then also Lutheran General Hospital in Park Ridge. Good to be here.
Good morning, everybody. I'm Sarah Phelan. I'm the Executive Director of People Made Visible, a nonprofit in West Chicago, and Healthy West Chicago sits within us. And then I'm also the board chair of the Mexican Cultural Center, which is also located here in West Chicago. And like Bensonville, we were also one of the communities hard hit by COVID due to our diverse population.
Thanks, Sarah. And Saba, welcome to you. Would you like to introduce yourself?
Good morning. My name is Saba, and I'm a student at UIC, and I'm working with Adam at the DuPage County Health Department for my field work this year.
Excellent. Welcome. Welcome, everybody. That was really helpful. It's what an array of skill sets and interests and capacities here. This is fantastic. Thanks for being here today. I'm going to move us into a look at Census 2020 and the impact that that potentially could have on our work. And what I'd like to do is introduce a couple of background concepts to you regarding the census taking, share with you a graph that compares the data from Census 2020 population count with what would have been a population estimate from 1 year ago to give you an idea of the significant change. I'm kind of biasing the waters here. Significant change by which we will be able to do our work as a health equity team. So I'm going to first try to share my screen here. So let's see if this works. Are you all able to see my screen? Good. The first background part of this look at Census 2020 is to remember what we were asked to respond to, the questionnaire, the survey questions that came to us. They came to us in a little different way in 2020 than they did in 2010. And you will see on the screen in front of you that there was a question about Hispanic, Latino, or Spanish origin, with the ability to add some detail underneath that. There was the question about race with a limited number of big box selections, and then an opportunity to provide some more specificity underneath that. So I want you to have that image in your mind as we look at now, what's the data that's coming out to us. What you see here is a tool that the Census Bureau has put together so that the actual count was done in 2020, but the data hasn't really started to be released until August. And the first big push for the release of this data has to do with redistricting. It has that political purpose. And so right now, the Census Bureau is busy putting together new tools to help people understand the data that's been collected. And this is one of the new tools that has come out in the last couple of weeks, and I want to commend it to you. So this data map viewer here is available to anyone in the public. you can drill down to DuPage County, you can drill down to a census tract and get actual count data, population count data on race and origin. And you see the ways in which race is organized there. And what I've done here is zoomed in on DuPage County, and maybe I could do this a little better to make it a little more obvious for you. And I've popped up the information about those members of our community when taking the survey who indicated some other race alone in their response to the census. And this is also something, this is beginning to give you a clue about what's different about this census. You'll see here that 6.7% selected that option. And that has big ramifications for the work that we're doing and big ramifications in the way that the numbers come back to us now. Any questions about what I've said so far or about what you're seeing here? Okay, let me try one more. Let's see if this one will get some interest. Are you able to see a chart on your screen now? Or are you still seeing?
Dave, I see the map.
Okay, so I'm going to stop share and reshare. What I've done here is put together very quickly a very simple chart that I hope will give you some sense of the change that's taken place with the arrival of new numbers. And all of the data that you see here comes from the United States Census Bureau. You see the first column on the left is the list of race and origin questions that the Census Bureau collects under those categories. The tan column, you see a population estimate from the American Community Survey. So in July 1st of 2019, when the American Community Survey estimates were compiled, these are the estimated percentages of the racial makeup of DuPage County. And these are consistent with the estimates from 2018 and 2017. There were incremental changes along the way, but you can then compare that to the middle column, which is the Census 2020 actual count percent. And a couple of things will jump out at you. You will see that the ACS estimate for white alone appears to have been overstated in comparison to the actual count. The Black or African American alone, this is a little more complicated one, because although you're seeing a reduction in percent, when we look below at the huge increases in the numbers of people who selected two or more races or some other race, you'll understand one potential hypothesis for what might be going on there. It might be that the estimate was wrong in 2019, or it might be that it's just changed in the way it's defined. You'll see that the American Indian and Alaska Native alone percent was underestimated in 2019. Asian alone, a little bit underestimated. That could also be a population change that could account for that shift. We don't see much change in Native Hawaiian and other Pacific Islander alone. I do want to note there are 315 residents in DuPage County who identify as Native Hawaiian and other Pacific Islanders. So they're very much on our scope to be included in our work on health equity. Now the next column, or next row you see is a biggie, two or more races. Whereas the Census Bureau is estimating 2% of our population, 2.1% in that category. When we took an actual count, 8.9% of our residents selected that category. Hispanic or Latino, the next row you see was underestimated in the 2019 estimate. White alone, not Hispanic, appears to be very little changed. And then the bottom column is also the big change. A new option that's being reported out is some other race. And you see 62,739 of our neighbors, 6.7% of the counted county identify in that way. So what I'd like to do is here I've put a few basic early findings from the census count of 2020 in front of you. And I would just like to open up to the group to ask you to reflect a little bit on how you see this affecting our work.
Well, I'm not so sure about looking forward, but looking back, I think that the results of the census indicate a really very strong and effective response to the census that we had, because we know in DuPage we're a lot more diverse than often thought of. And at the same time, we know that the census is the way to make it happen. And so when we gathered together on how to approach the census as a community right before the pandemic really launched, we made some plans, and I think everybody on this call and beyond took this as a really strong opportunity to advocate on behalf of their constituencies. And I think for a minute we have to celebrate that. It looks like we were successful. And then we can go to the work.
For Karen, I wish that I had included one more row here to make your point. If at the bottom of this chart, I put another row that said total population, the ACS estimate in 2019 would read 922,000. And then the number under Census 2020 count actual would be 932,000 plus. So that was a pretty significant underestimate of the total population of the county. And so we underestimated in census numbers, the actual number of people, and we underestimated the diversity both. And now we got a much better picture to work with. This is much better. So any surprises here? Are you soaking this in? Any response, any thoughts?
Dave, you know what I have to say.
Please. And I'm so glad that you will be able to, because we've been spending the last 3 months finding a way to remedy that. But if you don't mind me putting that burden back on you, Dr. Asfar, please.
Yes, I know we all are feeling that burden, and thank you for showing this, and again reminding that we really need to work more to identify our Middle Eastern and North African community, which is missing from here. We don't know where they are. They might be in white alone, they might be in Black or African American, or they might be some other race. We don't know. So we need to figure that out, because the community which we serve, we have plenty of clients who speak Arabic language, who are from these countries, and we don't know if they receive the vaccine, if we are talking about vaccination or other services. That's the concern.
Thanks, Dr. Asfar. And I want to, if I could follow up to that. At our last meeting, we looked at 5 recommendations from the HEART team to remedy that situation. And one of those recommendations that had broad support here with this group is that the United States Census Bureau and the Office of Management and Budget, which oversees the Census Bureau, needs to restore a path to identify a Middle Eastern and North African identity in census activity. And that their path in that direction had been interrupted by the previous administration. And we're recommending, strongly recommending, that they restore that pathway so that future equity teams can look at a chart like this with actual census count data and understand MENA, Middle Eastern, North African presence.
Dave, I had something to share. Can you hear me right?
Yes, yes. Welcome.
Thank you. Welcome. Good morning, everyone. It's about, I have concerns about the Hispanic or Latino or white alone, no Hispanic. I find the second generation and third generations, they have the struggle to how to see is identity. You know, they don't define if they are Latino or they are white. I think many people considering a white, even if they're second generation, because they merge, you know, or they grow up here or they are born in here. So this is not clear for me, you know, and I don't know if that number reflect the really amount of the Latinos in here, especially in the patient, everywhere I can say that, you know, because we know there are more than that number. So when I see the white alone no Hispanic, you know, I'm pretty sure a good amount of this, they're part of the still Latinos. So it's something we need to consider, you know, how the people thinking, especially second and third generation. And to answer this, and how do they interpret this when we do the census, you know, I'm sure they're not, they don't know. Yes.
I appreciate that comment. And what's going through my mind as a kind of a consequence for the work that we're doing, we're going to be sharing as a team race and origin information in our work. And we're going to want to make sure that we're not presenting a chart like this without some notation along the lines of what Dr. Asfar has raised up, that we're aware and working on a missing element in this categorization for MENA neighbors. And number two, that we're aware that we'll find the right phraseology for this, Reverend Briones, but we need to acknowledge what you said too, that these charts kind of take on a life of their own, and we want to make sure that we're always putting context around them.
Dave, this is Kara. I just want to add the comment that one of the things that I do appreciate about, and this is sort of just the beginning of what I hope will be more information to come, it feels as though Census 2020 is taking a decisive step forward in terms of creating access to some of this information in interactive and helpful ways. And I know, although I have not yet seen it, that similar to the ways that they are displaying and making available to us some of this early data around race and origin, they're also doing similar work around health insurance and health access. And so I think that as we are a group that's focusing on both health equity and issues in regards to race and national origin, looking at these two as a point of intersection as more of that data becomes available, and figuring out how we as a community can use that data to make demonstrable change. It's exciting that we have that, and we haven't had that before. So it feels like a step forward and a help to our efforts.
Thanks, Kara. And I would encourage all of our members to register with the United States Census Bureau to get bulletins about their pulse survey. I'm not a demographer. I'm not a census nerd, but I have signed up for that news alert. And so the headlines are telling me what's the direction they're going in. What are they paying attention to that will be helpful to us? And I would encourage others, if you're like me and you're not a data nerd or a census nerd, but you want to stay up, that's a great way to do it.
I have a couple comments. I'm remembering all the fiasco from the previous administration that intimidated many people from participating in this census. And I guess there was trying to be some propaganda against that, but it wasn't enough. I guess to eliminate that fear of participating, because I'm looking at the numbers of the Latino, and I'm glad that increased from 2019 to 2020, but still I know of many people who just didn't open the door because they were afraid, and neighbors. So how is it that we will address that so that they don't feel, oh, if I do this, then someone's gonna knock at my door later and come in and take someone away, and then how do we, like, for before the next census, how do we talk to people about, go ahead, do this, because nothing's going to happen, whatever, whoever says no.
I think that's the key strategic question. That's our heavy lift going forward. And to help people take control of their own health destinies, we have to find ways to connect. But rather than interrupt the fantastic question or divert it, I want to leave it hang with the whole group. Other thoughts in response to Julietta's question?
Yes, please.
Something that we've been thinking a lot as we've done inroads into vaccine hesitancy or pushing out information in ways that's more community member based. I also wonder how we can take those lessons learned and translate them to future census. So it is much more community led in a way that actually reaches people where they're at. Because I think that is something that on a lot of levels we haven't done well. And I do think the ways that this long vaccine campaign has actually allowed us to learn lessons about that.
Yeah, because one of my friends, she was doing this with their organization, and it was very difficult. They would knock on doors, and they knew that's where people were to be counted, and they wouldn't open the door. There was so much fear. So maybe before we even approach the next census, we need to lay it out there that it's okay. This has nothing to do with your status or anything. This has something to do with counting you because you pay taxes. And we need to get the social services and all, so that everybody can have something.
Julieta, I remember a conversation that I think actually Mary Keating was a part of early in the census effort, where it was explained at, I believe, a DuPage Federation meeting, not only that, because it felt like a valid fear, frankly, under in the circumstances in which we found ourselves in the past census count, be worried. And it was hard to know whether or not you could be adequately reassuring to populations that had fear around immigration status, that this wasn't something that placed them in jeopardy. And the thing that offered the most reassurance to me, and was actually comments that you made, Mary, around legality, the fact that not only that the U.S. Census was designed with a sort of an ironclad delinking of their information and the rest of government. And I certainly don't think that that was a comfort level that permeated to the rest of the community. And Julieta, what I really think that that speaks to is the value of community health workers, because I think that it is very hard to move that kind of information through the system with anything like success, unless you have folks that are really embedded within the community that can help to tell that story. And I think we have to start earlier in building that bench strength, or else we won't get there.
Well, this is Karen, and yeah, I couldn't agree more with all of that. And I don't think it's only an issue around the census, right? I think it's an issue because the point that you brought up, Kara, about what I didn't feel, even with the protections afforded to the census previously, I didn't feel extraordinarily confident that those were going to be kept in place going forward based upon federal oversight. And so I think it is that ongoing opportunity that our communities have, better than any one organization that our communities have to engage in. You are a valued member of this community, period. And we want you to take part in that. And so back to the elections thing, getting people registered to vote, because that matters. And it's in some ways feels like a long time ago, and in other ways it feels like it was yesterday that we were dealing with some of these concerns that we had never had before.
I agree with Karen. Karen said, this is very hard for, especially for Latinos, to expose how difficult it is for those immigrants here that they don't know how it's going to be used, the information, his data, and they prefer continue in the darkness. They're pushing to don't know what is exactly number of people who are around in here. In some way they feel like in the community, but they don't can involve the community. It's another cultural thing that happen. Also that there's still the difference between in the population of the people, even the Latinos. Latinos who's got a residence or they are citizens in here, they treat different people who are not documented, and there's many feelings. But I'm glad to mention this because they're helping us to understand why even the people don't respond the same way to the vaccinations. Why people this afraid to coming out. They don't know how it's going to be, especially the government, how they use all the information. We have the experience from the last administration, how difficult it was, even to walking outside, or go to the store or go somewhere, I remember when the first times that we provide the vaccination, just to see the police and the National Guard, they was so confused. So I'm still there, there's a lot of trust, and unfortunately, this is that we continue working. How can we provide the right information, but how can we gain the trust for all these people? Like Karen said, that everyone is welcome and they're part of this community. This is a work and practice. It's so hard. It's so hard, especially with this still trading in many ways, in many places. A different way. So we have to thinking about but I'm glad to hear that because this kept helping us to continue or move forward, to find out how it can be accomplished, and I know still people they don't just don't want it, like we have to respect that, but I think we need to be conscious that how important is like the vaccination for everyone to protect each other as a community, besides a political or status, but this is the challenge we have right now.
Reverend Miguel, I think you said that beautifully. And I apologize for disappearing, but my computer just froze. And Mimi is on here somewhere. I think she's going to, there you are. She's going to touch a little bit on that. I think the awareness that we cannot look at population health as this huge puzzle that we just fit people into, but that we look at it and we understand that we must communicate and respond to various populations in very tailored or unique ways. And building those relationships of trust is tantamount to us having success in our public health efforts.
Jan, your hand is raised. Oh, sorry.
Is there a hand raised?
Yeah, I have my hand raised. I don't know if anyone else has. What I want to say, this is Esma from ICNA Relief. Oh, I understand the Latino community's fear, like of fear of deportation and immigration status and that. But I think as an Arab American, from my perspective, it's something beyond fear. It's for us, it's like what Dr. Asfar said, it's about recognition, about value. If I look at the census and I don't see myself, my people represented, then I don't feel a sense of urgency. I don't feel valued. I'm not going to feel like I should fill this out. Especially if I don't know what this information is going to be used for, then I'm not going to fill it out for sure. And I don't see myself. So that's very important. And I also want to echo what Kara was saying, is that if people don't know what is the purpose of the census, they don't understand it, then why are they going to fill it out? What's the benefit to fill it out? And that's why it is important to have ambassadors from the community who will understand and will convey that message. But first of all, if you don't have that category for Arabs, for everyone to be counted, then what's the point? It's supposed to be a census to count us. So if we're not being recognized there, then why are we going to even fill it out? Why are we going to even look at such a thing?
Yeah, I agree. Yes, that's one of the, sometimes that is what is brought up in our community, because not everybody relates to being Hispanic. They're people from Mexico and Latin America who they identify as the indigenous of those areas, and they would like to see all of a sudden someone from Oaxaca, from a indigenous place, has to put that they're Hispanic and they're white, and I'm not white, from an indigenous group. Where do I put that here? Sometimes it's like, I don't know. I had to put that I'm white myself, but I do hear that, and I do see that concern that if we don't see the place for us to say who we are, then why are we doing this?
Yes, definitely, Juliet. I totally agree with that. It's supposed to be a form to count us, but it's not counting us. And I used to pick the white, but I have not in several years because it's absolutely incorrect. We have no roots in white. So there's no sense for us to choose the white.
Mm-hmm.
So that's the first step, I think, is identifying groups of people. I understand there could be potentially hundreds of groups, but for an Arab coming from the Middle East, from North Africa, that's absolutely ridiculous not to be counted. That's something that just blows my mind, that it's not there for us to choose.
Yeah. And then I think we also have to look at the next generation, right? Because in 10 years, we will become even more diverse. And so I look at my own kids who are mixed ethnicity. So do they identify more as Latinx or white? And I think it just perpetuates that that ability. And I think the fear is, the more choices we give people to identify in their race, the more divisive it will become. And I think it's more the opposite. I think that provides us with an opportunity to really understand what an amazingly rich and diverse universe we live in, whether that be our community or our county or whatever. But I think we're really fighting that fear. And so if we're looking at challenges for this next 10 years, I think that absolutely is one that I would put on the list.
Yeah, Karen, I think that was brought up before of, someone who's mixed race. If they have one parent who's Asian, for example, one parent who's Black, what would they choose? And what we thought is they would choose what they identify as. We can't choose for them. They have to, what they feel comfortable choosing, what their lifestyle is, that's what they would choose. It's not for us to choose for them. I don't think it's a difficult issue. I think it's what you live your life as. That's what you should be able to choose and to be recognized and respected as that.
Oh, absolutely. But I think in the past, it's been, at least traditionally from a government perspective, you go by your mother's at race and ethnicity, and there hasn't been that. And so I think we need to start breaking that out because my kids very definitely, it almost depends on the day when you ask them, right? I'm not saying we ascribe, but I think we just need to be more open to those voices. Absolutely.
Yeah. And Karen, besides to be open, I can see in a rational way how it's made this census, from who's made this census. I can see the whitenesses, that way, because the option that they give you is the make you feel like your answer is, okay, have no finding in the my identity in this answers. I can option for the white, and I can feel like a part of, of the unprotected in some way. If you are considering a white, this is why many people answer that way. So again, we have to consider how this census, how these questions have been made, and we know this coming from the government, but the government it's majority white people, who they need to understand more about the diverse, and that way to have more options to answer that we don't have right now. Again, many people just answer and prefer, I'm including too, to say, oh, well, the easy way, maybe say white and I'm peace, I'm fine. But we don't understand what's important to say, what is my my race or what is my identity? What is not reflected in that questions yet. So we have to find out, and we maybe find, and like Karen said, in 10 years, understand what does the diversity mean, understand all the different ethnicities or races that we are in this country, because of course this is changing. This is one of my biggest challengers, when we are in the community to try to dismantle the racism in the institutions. We find out that they are majority thinking like white people, and they don't understand the diverse or the minorities or people of color, say in other words. So we have to be open our mind to this understanding. This is another process. Jen is understand what they're talking about, because this is very difficult to put in on the table and discuss about that. So, but this is something important considering to able to understand, learning, to give the next steps and be more inclusive, be more really intentional on what I want to do, and we're going to find more answers, definitely.
So, Mr. Roth, in the meantime, in the meantime, what do we do? Because there is still a need to collect data because, as you know, data drives the kind of programs that we need to keep people healthy. Likewise, as you noted in your opening comments, we agree we must change something here. We must have a way of identifying people to include them in the human experience in our country. Are we then setting ourselves up to lobby Congress or to write a letter to the OMB to say, you know, what's next? What do we do? What's needed to be more inclusive in future census counts?
Jan, thank you. Actually, I'm going to take that excellent question as a way to also segue us to one of the most important things we can do, and that is to build our own relationships of trust. So I'm going to, in just a minute, I'm going to hand this to Mimi regarding an update in the focus groups. And also, I don't want to forget to say this, Julieta, thank you for launching the strategic question. Just like Jan is closing us with the strategic question, you opened us with how are we going to address this? And Jan comes right back to that.
Thank you, Jan.
Okay, well, so one answer is as we'll be doing this work locally at figuring out our own context for building the relationships to trust and getting the information we need. We're certainly going to move forward on advocacy in the Census Bureau, and the Census Bureau right now is an ally. So they're on a track to include a MENA category. They're on a track to test messaging. They have to make the decisions about with limited space, but I'm not going to defend them right now. But so, and I will be back to you, this entire group, with our set of recommendations, updated recommendations, the next time we gather regarding how we address the MENA category nationally, statewide, and locally. That group did meet. The subgroup met a few weeks ago. We have tasks out there, but I don't have a specific set of recommendations to bring back to you today. It's an insufficient answer on a work in progress. But I do think it's important for us to move to one important way that we're doing the relationship building, the trust building, and the good information collection, and ask Mimi to talk about focus groups.
Hi, everybody. Let me just go ahead and share my screen here real quick. Is everybody seeing that as the
Looks
full
good,
slide
Mimi.
view?
Yep.
Okay, great. Okay, well, welcome everybody. This is a great way to segue and talk about ways to build that dialogue in Dupage and build some of those relationships and community conversations. So as part of that work, extending from the survey work that we had done in kind of February, March timeframe, we have built out and started doing some focus groups or community discussions to get specifically at just that conversation. So as I've shared earlier, we have 3 community discussions planned, and our intent was to look within communities and build that dialogue with communities that were disproportionately impacted and or that we felt like we did.
Mimi, your sound is a little
strong
in and
response
out.
from our survey work, and wanted
Mimi, your signal is getting sketchy.
Maybe turn off your camera, Mimi, if you can.
I think she may have froze.
Oh,
here we go.
As we wait for Mimi to come back, I will say that we rescheduled the Latinx event because we didn't have adequate enrollment. So it is fantastic news that there are 14 people currently registered for that event, because there was 1 registered for the last event that got canceled. So I'm sure she'll be joining us momentarily. And in fact, I think she might be back.
And
can you see my screen again?
Yep, yep, you're back.
Welcome
All right,
back.
sorry about that, everybody. Never a dull moment. Okay, So I was just trying to go through where we're at with the community discussions. We completed the Black and African American one last week. We got 6 out of our 8 registered attendees. The Latinx one, as Kara was just sharing with you, we had to reschedule it because we didn't have enough attendance, and that one blew up in a good way for us. We have 14 people registered right now, and that's scheduled to go next week. And then the following week, we have our MENA group scheduled, and we have 4 people registered so far and are hoping to register more before that time, because we would really like to have a good, robust community discussion. But let me share with you the findings, at least from our first group. I do want to caution, this really is findings based on 6 people in DuPage County, so take it with that in mind. But I also think it's really valuable to get that that discussion, that kind of conversational perspective, and I'm happy to share that with everybody today. So first, one of the areas we queried around were, what were the concerns people had? And I should back up and say we were aiming to speak with people who were hesitant about getting the vaccine and either maybe hadn't gotten it yet and are on the fence, or people who have recently gotten the vaccine and you know, hesitated for some time, but could share our reasons why they were, you know, what delayed them, what was the concern. I'm happy to say that all of the people at the time of the group were vaccinated, and one had literally gotten vaccinated that same day. So hooray. But when we did ask around what were people's concerns, one thing that came out was the long-term impacts of the COVID vaccine itself, and weighing that against the long-term impact of COVID illness. People expressed concerns that the vaccine still felt relatively new to them. And that they felt like there has not been enough duration of time vaccine itself might have.
We're starting to lose connection to you again, Mimi.
We did find it interesting that the vaccine itself seemed almost as concerning as COVID itself. So I think that's something to consider and be aware of. As many people in public health would. Oh gosh darn it! Can you, if I talk fast, the internet
Hey
will be
Mimi,
kind to me.
hey Mimi, just a thought. If you
yeah.
want to just talk through it, maybe take your screen down, we could have your voice, and maybe we'll get the slides later.
Okay, sure.
And not to shorten it, but I think we want to hear you.
Yeah. Yeah. Okay. All right. So I will go ahead and talk through it on my own then, and then I will share out the slides. We also found some variation. You all can hear me now?
Yes, good. Spoke too soon.
Great.
Hey, Mimi.
We found some variation in trust. What's that?
We've kind of, you gotten sketchy again. I think what I'm going to do is suggest if Nicole and Kara and Mila are ready, we might make a switch and then see if whatever it is that's getting you held up, if you've got some other solutions on your end that are just going to take you a couple of minutes to remedy, we'll come back to you. And so I think maybe that's our best use of time right now. So health equity in DuPage, 2022 to 2025.
Hi, everyone. I think Kara and I are going to just move through this part of the agenda, mostly to get everyone familiar with the work of Impact DuPage, and then also kind of tee up what's coming in October and November, and how you all can use your power within your communities to kind of help us achieve some success, and talk about all the work we've been doing all this time and get it into our planning and our assessment process. So Kara, if you don't mind, I'm going to turn it over to you to give a little bit of background and kind of kick this part off.
Sure. Recognizing that this is a group that is equally split, or probably pretty equally split, between folks who have familiarity with this process and folks who may not. Every 3 years, under the leadership of the health department, but with the goal of engaging all of the community, we have a assessment, querying, and planning process that has a number of subcomponents. One piece is a broad community survey. So look to us to be reaching out to this group and others as a means of helping to distribute that survey. That survey really asks for all of the community to speak to what they consider the key priorities for the coming 3-year term. And it's so critical that we hear from as many voices as possible, because this is a situation in which it has tremendous impact on how we do our work. And if we only hear from one segment, we've really missed the boat in terms of representing what the community wants us to work on. So that survey is going to be distributed by social media, by paper, by email, by pretty much all the different ways that we can. And we'll also look for our community partners, for those individuals for whom those tools are not a good fit, to be also creative in figuring out ways to engage the families that they serve. Separately from that, and the place where we're going to be planning around an October meeting of this group, there's something called the Forces of Change exercise. And this is really, you can kind of think of it as a focus group of sorts. You can also think of it, for some people, they may be familiar with the term SWOT analysis. It's really a series of open-ended questions that are asking people to think about what they anticipate, what projecting forward, what they think are likely to be the most pressing issues, both today and in the future. And it's a community conversation. And again, you want to have as many of these community conversations as possible. So a number of folks within this group may be having this conversation in other organizations in which they operate. But our hope is to host one of these Forces of Change exercises here at HEART in October, and we will do it virtually. This is a little bit of a learning process for all of this, because historically this has been something that we did in person, and we don't have the benefit of that intimacy here. But what we'll be doing is breaking up into breakout sessions and looking at this series of fairly open-ended questions as a way of fostering dialogue, and then just capturing people's feedback. All of that feedback is then aggregated from all of these different Forces of Change exercises across the county, and there's sort of a summative document that's intended to collect all of these voices into major themes and trends. Out of all of that comes an effort at the end of this process, and there are a few other steps, but in the spirit of time, I'll abbreviate it. But the end of this is that we as a community select a handful of places where we really want to be very intentional and focused in the next 3 years in marshaling all of our collective effort toward seeing demonstrable change. And notably, one of the reasons why it's so important that we do this well within HEART, I think that we have a compelling need to make certain that we are centering this effort on issues of health equity and issues of racial equity and racial justice as well. And so we want to make certain that those topics get a full airing through this process, so that the places where we should be focusing our attention come to the foreground.
Hey, Kara, if I could just add and give Nicole a chance to, if she can jump in on how the hospital kind of connects the dots here, because it is an opportunity for a full system assessment, and we only do it every 3 years. So it's critical for all the health partners to jump in, and all the other community groups as well. Nicole, do you want to add anything?
I would just add that, the Forces of Change assessment is really critical, because we just talked about the lack of data within the census around race, ethnicity, and being able to capture specific groups in the county. And I think the Forces of Change assessment really gives an opportunity for some primary qualitative data from those specific groups that aren't necessarily captured in the census. That's the only thing that I would add. Thanks, Mila.
Sure, no problem. Any questions from the group on the process, or, I think in October, we'll spend a few minutes talking about the background and showing some graphics that put all these pieces that Kara talked about together. And then we'll have a really engaging conversation and have a chance to get in deeper to some of the trends you're seeing that we've discussed today, but it will take a good part of our meeting next month. So we're really excited to be able to do that. It also gives us an opportunity to look at what we're seeing now and maybe even look forward at what we think those forces of change are that impact our communities.
One of the things that we'll be doing in advance of that October meeting, but probably in the week prior, is to share the questions that will be the focus of our discussion. It's helpful to look at them beforehand, so you can think a little bit about, in the days prior to the event, about where you think there should be focus. Sometimes if you get them on the day of, you're reacting rather than responding, and we want to give people ample notice.
I really like this opportunity, and I'm pretty sure my colleagues, Immigrant Solidarity, will get on this. This is a good opportunity to get our community to say what their concerns are. And I'm looking right now at doing a small forum or to see if people come and we can talk to them about the survey and have them fill it out or knock on doors too. So this is a good opportunity. I like this.
Sarah, your hand is raised, I see.
Yeah, I also just wanted to mention, and maybe this is something to keep on a parking lot or to talk about further at another time, but as we look at branching out and creating bigger focuses and making sure that we're getting deeper into the community, to also be talking about resource allocation, and that all of this work needs an incredible more amount of money, time, manpower. And I think, as we think about, Janice brought up, like, are we, does this lead us to petitioning the federal government? But also, are there ways that we can make presentations at the county board or even at the state level to show what this group and all of the community partners have shown, but actually the manpower and the hours and the need for more resources towards this work? Because I think that's an important part to make sure that this is sustainable in the long haul.
Any other
Good point,
questions?
Sarah.
Yeah, thank you, Sarah, for adding that in. That also so nicely aligns with our earlier discussion about data and building trust. Mimi, can we invite you back in?
Should we try again?
Yeah.
All right. What I'm going to try is sharing my screen without going to presentation mode, because for some reason, last time when I presented, that did it. So can you all see my screen?
Yes.
Okay, and you can actually hear me?
Yes.
Okay, great. That's a win then. Okay, I think we left off right about here where we were talking about the people's concerns about the long-term impact of the COVID vaccine itself, as being equally concerning to people as well as the long-term impact of COVID, the illness. So that was certainly one strong theme that we saw from our group. Another one was exploring trust around the COVID vaccine. We were happy to see that people reported trust seems to be growing over time as people get more familiar with the vaccine, and we're starting to get full approval status, for example, with the Pfizer vaccine.
Hey, Mimi, we're starting to run into the sketchy connection again.
But there's still a lingering climate of mystery.
Clearly, there's a lot of good stuff here. We're going to find a way to get this to everyone. It looks like we may not be able to get it done inside the meeting. Mimi, can you hear me?
Is this presentation something she could email to us so we can?
We'll ask her to do that. And now the
Yeah.
question is, if we move to our COVID-19 update, Health Department.
David, before you move, can
Mhm.
I just say, because Mimi, Nicole Edmonds, and I have been working on this, and I just want to kind of bring everyone, I sort of put something in the chat that I thought I was direct messaging to Mimi, but what we are doing is we're working on organizing an effort to convene town halls. Again, we have a problem. When health surveys are done, we are not getting the kind of response we need from many of our marginalized communities, and especially in the African American community. I think on the last survey, we had, 70 or 71 responses, which I'm embarrassed because I'm sure I called and texted at least 75 to 100 people. So I thought we should have at least had 100. But when we look at an overall population that exceeds 45,000 African Americans in DuPage County, we've got to do better. So hopefully with these town hall meetings, smaller groups, so that we can have meaningful conversations. And part of those conversations we will take that opportunity to discuss why we do surveys and the importance of everyone participating, again, because the data will drive programs that will hopefully improve health, create more opportunities for health access, and definitely improve health outcomes. So that is the direction that we are going in. Mimi, should we mention, you want to take it from there? I see you're back on.
I am back on.
Okay.
I
Hey,
can try and
Mimi.
read slides to people.
Well, here's what I'm thinking, Mimi.
Yeah.
In your absence, Jan has given a kind of a immediate and strategic direction to this work, moving toward town halls,
Yeah.
in engaging a group of people who it's been difficult for us to hear from. And the focus groups is a good step forward in that direction. I'm wondering if you would be able to share these slides with us through an email and add to that anything that you feel like you need to in terms of commentary. And then we want to, I want to commend the process that Jan is talking about to everyone. This is, I believe, the way we're building our capacity and kind of muscle mass to do this connection and relationship building around important data that requires trust from our community. I feel a need now. I want to move us into our DuPage County Health Department update so that we're sure to spend time on that at what is once again a time of high risk transmission. And so, Adam, may I invite you?
Absolutely. And I am going to share my screen. I have a few slides. Can you let me know if you can see a full screen?
Yes, it looks good, Adam.
We can.
Okay, great. So I will try to, move very quickly on these issues. And so please, put in the chat or stop me if you have a question. I'll speed through because some of this stuff I think we've talked about and is known, but whatever is most interest of the group, I want to make sure to prioritize in the limited time we have left. So, we're always monitoring the situation on the ground with COVID and what does the activity look like in the community. The primary tools that we use for that are some CDC tracking resources and some IDPH tracking resources, as well as local data combined. But when we look at CDC, they really set the definition for when we are in, and you hear this, and a lot of mitigation strategies are based on this, but when are we in high transmission versus substantial or moderate or low? So wanted to make sure everyone was aware, DuPage County is still very much considered in high transmission level as defined by CDC at this time. And this is how that is defined. So you can see down there in the bottom right corner, the red category, the high transmission category, is defined by having greater than 100 new cases per 100,000 people over the past 7 days. And this gets updated daily with about a 2 to 3 day lag from CDC. And you can see the link down there. We can make sure to drop that link if this is the kind of thing you're interested in tracking yourself. But most recently, you can see the number of cases reported as of the 16th, total over 7 days, the percent positivity, the new hospital admissions. And so all of that comporting to still being in high transmission. There's 4 slides here in a row that I'm going to zoom through really quick, just so you can kind of see the evolution of coming out of the June sort of swoon when we were in the lowest category, and then when Delta started to surge in late July and in August. So here's late July, and we were in low or moderate at that time. Then by the end of July, we were in moderate or high. And then by mid-August, we were in, the entire state was in high transmission, and most of the country was in high transmission. And most recently, in mid-September here, this is just less than a week old, this visual is most of the country is still very much in that high category of COVID transmission. So just to give a sense of the case activity locally as well as nationally, those few slides paint that picture for how Delta has kind of swept through. And what that means, okay, great. So what does it mean we're in high? Well, when we're in high, you can see here at the bottom, CDC advises on what types of protections and community level mitigations we should all be adhering to, have in place, and help promote. And it does scale down, so if case activity comes down and we get down into moderate and low, some of those mitigations can be relaxed. So that's what this aims to describe and give you a sense of that when we're in high, that's when you're going to hear public health saying we need to practice all of the mitigation layers. As the maps showed, those very bright red maps, Delta variant has swept the country, has taken over. We know that it is at least 2 times more transmissible than any previous variant, and that it comprises over 98% of all the sequence cases. So it had swiftly become the dominant strain and is the source of the recent surge over the past 6 to 8 weeks. Chris is usually very good about, and his voice in my head reminding, there's not just one thing that we look at. And I think that that's what can be difficult about this at times is, well, if cases are the only thing we look at, is that tells the whole story? And it really doesn't. So certainly we look at hospitalizations, we look at deaths. There's a few different metrics that we look at to say how are things going. What we are seeing is although the cases are very high, we're starting to see a little bit of a flattening of that. We hope that we're on the other side of that peak. It's a little too soon to declare that, but we're starting to see a flattening in cases, and we are starting to see the reduction in hospitalizations. I think that one really positive thing, and if you take nothing else away from my presentation today, I would want it to be that the vaccines still work even against Delta. They prevent against the most severe outcomes, and our community and all of you should be commended on your work for helping advance the access to vaccines in our community, because DuPage does still lead the state in the rate of people vaccinated. And I think that that is at least a part of the reason that we are seeing that our hospitals are not completely overrun and out of ICU beds like you are hearing in the southern part of the state and maybe other parts of the country. And we're even starting to see a little bit of a reduction in the hospitals, hospitalizations in DuPage County. So this is here, the chart you're looking at on the left, that's our 6 hospitals in DuPage reporting into us about the number of daily hospitalizations. And you can see that over the past couple of weeks, it's actually going back down again. On the right, those are IDPH charts where you can see that trend is stabilized, flattened, or slightly reduced. That's actually region 8, so that includes us and Kane County. But you can see, again, collectively, I believe the takeaway here should be that the vaccines are protecting our community members against the severe outcomes of hospitalization and death. This is just another view of hospitalizations over time. So you can just see that, you know, we had a significant, in last winter, a significant increase, and our hospitals were struggling. Then the reduction in the early spring, and then the lowest low point in June, and that Delta has caused some peak, but just putting that in context, not nearly the peak that we saw last winter. And again, we believe the vaccinations have a strong protective effect in that regard. And here is sort of the further evidence of that. So of cases, hospitalizations, and deaths, we are seeing those occur primarily in individuals who are not fully vaccinated. Make sure I get my terminology absolutely correct there. So of individuals who are not fully vaccinated, that's where the majority of cases, hospitalizations, and deaths are occurring in DuPage County. So these rates are DuPage County rates reported since May 1st. Here is just a listing of our rates by total population, rates vaccinated by total population, by population over 12, who's eligible, by all adults, and by those over 65. So you can see the percentages that have at least one dose, the percentage that are fully vaccinated. Again, our rates that you're looking at are the highest in the state of Illinois. And Chris looked for me the other day. It's in the top 7% nationally. So again, another, you know, shout out to your support on this group and the support of other community leaders, whether that be the health systems or the mayors or the county board. Really, our community, I feel like we feel as a local public health department, we actually feel very lucky to have the support of local elected officials, as well as community members and community leaders at the CBO level, all working together on this. And that is why our rates are so strong. And so a couple quick, I'm realizing the time, couple very, very quick. Our caravan is a big part of this as well. We closed down the mass vaccination site in July. This has been out and about almost every day, 6-7 days a week, sometimes multiple days a week. And I think the important thing here is that you guys can help us point this van to where you think it needs to be. And I believe some of you have done that already and have been active, and that's really been helping. But we're still doing it. So if you still have places you think this van needs to be, we're very receptive to that. Here is a somewhat recent schedule. You can see we had a couple events the last couple days, and we are in Roselle today, and then in Villa Park tomorrow. I believe the schedule is being updated now in our weekly newsletter, and that will be sent out for next week as well. So very, very busy team working the caravan. So kudos to Andrea Gargani with the health department and everybody working with her on that. Also, if the van is not able, is not in your area, isn't coming soon enough, the health department is vaccinating everyone who is eligible on a walk-in basis at either our central office in Wheaton or our East Public Health Center in Lombard. Those are our normal business hours, Monday through Friday, 8 to 4:30 right now. And just a quick note here, we are planning and preparing for boosters. So you're probably seeing those headlines. You may have questions about that. We're on top of it. The FDA is meeting today, and we're ready to be active in that space of providing boosters, of pointing people to where else they can get boosters, and making sure when boosters are indicated, if they are indicated, everyone understands who is eligible. So we're working on that. And I'm sorry to speed through it, but I wanted to try to get close to time on that. So I don't know how you guys want to handle questions. If you want to do stuff offline, Mila, Dave.
Adam, I think you just had a couple of other things that you're going to show on some of the race and ethnicity or zip code level things. We can share those via email, unless you just have some summary statements you wanted to share.
Yeah, well, so we are, I would say we can send that information out. I would say in the last 2 months since we closed the mass vac site, between the caravan getting in the community and the walk-in basis, I think we're seeing a little bit better of a reach into non-white populations. I think they match up pretty well. given the limited data we have. Amila, I sent you a note. I think like 28% of responses of people responding in our system are either saying other or prefer not to answer. So there's some limited data, but of those that are answering or are identifying in a group, we're seeing that those populations are a little bit higher than they were earlier, and the non-white groups are being reached a little better with those efforts. So always still a ton more progress to make there, but we can send that out. And absolutely, I think the caravan's a big part of that. I think those of you who've helped us figure out where the caravan should be is a big part of that.
Thanks, Adam. I think Jan's, work to get to the schools in Naperville and make sure that the people that may not have had a chance to get vaccinated had it very convenient for them with the caravan. And other folks have, been working really hard in Bensenville and Addison and West Chicago and kind of throughout the community. So just a great reminder that if you feel like there are more opportunities to utilize the caravan, to get in touch with us.
Can I get a quick question into you, Adam? Jan Geider here.
Yeah.
Evan Summers indicated in his introduction, hi, Evan, that his community, is it Bensenville?
Yes,
has been particularly hard struck by the COVID pandemic. Do we have information that shows the vaccination rate and the incidence rate of COVID in these communities? Because I'm thinking if we knew what communities that were more vulnerable, we could target those communities with more vaccination information.
Absolutely, yeah. So our local dashboard, the one on the DuPage County Health Department's website, will show case activity by municipality. I believe we have that available. And so we can take a look at that to the first point. We have had a harder time with vaccination by zip code or municipality because that data feeds into the state's registry and it's not available. Well, historically has not been available to us, although I did just learn that IDPH has recently launched a web page that has vaccination by zip code. I just put that in the chat now. That's very new to me. I know our team at the health department, it's been new to us this week, and we've been trying to communicate with IDPH to make sure that we understand the data is accurate and that it's populating correctly. But we do have those two pieces. We can look on our dashboard at incidence and case activity, and then we can look at their dashboard on IDPH by vaccine rate and try to match up where we think we need to do the most work.
Okay, so Adam, this is information that you have. Evan, this is information that you have. So do you know where, if we wanted to target your community, do you know where you would send us, for example?
So Bensenville only has one zip code. So when we look at zip code data, I'm not able to granularize that down to certain neighborhoods. We do know where our low income, high density immigrant communities live. So we have done a great job targeting that. And just anecdotally, I do feel that the Delta surge has been blunted by the vaccine efforts of the county in those communities.
Okay.
And I can't get it by, we have been granted access to some information by Census track as well. So if that's better for people, we can start to dig into that too.
So maybe
tracks are kind of a mixed blessing. Some of them are really helpful because they're contiguous to a community. Some of them cross communities in ways that can make the data harder to interpret because you could have very high rates and very low rates and end up with something that looks like somewhere in the middle.
So maybe this is something that we can use as a tool, right?
I think so.
Okay, great.
And the question, Adams, is the caravan provide only one kind of vaccine, or people can find, especially those looking for a second shot, they can find more than one vaccine in the caravan?
Yeah, the caravan can do either Johnson & Johnson single dose series or the Pfizer 2-dose series.
Okay.
This is Evan up in Bensenville, right? We have been working Immigrant Solidarity page with IDPH, IEMA, and tomorrow we have a vaccine clinic up in Westmont, La Huerta, number 6. And we've been trying to target these places that haven't gotten the vaccines. And we're willing to come out there in Bensonville with IDPH. I could find out where to go, what business, or if you could find out where is a good spot to bring IDPH IEMA out, we can do that.
Thank you. I really do appreciate that. I have to say that the health department and Evan Summers have been in almost constant communication since the start of the pandemic. I think that vaccine is available within our community. We're not done by any means, but it's not a shortage of vaccine in the community. That's a challenge. I think there's hesitancy is a chief challenge, but we've done some pretty innovative ones where, we've got undocumented minors that came over and IDPH partnered with us to sign off and get those children vaccinated. So we've done some pretty cool things that we're really proud of. But anytime, if you want to come out, we've got a La Huerta numero 2 here. We'd love to have you here. So
all right.
Let's connect on that.
I'll add that we have a vaccine event at DuPage Health Coalition, and you're welcome to join us, Julieta, if you wish, next week in Bensonville, and I think 3 weeks after as well. Mila asked me to say quickly a little bit of good news, which is that we've been tracking our vaccination rates within Access DuPage patient population, which is a exclusively uninsured and primarily Spanish-speaking patient population. And we still have a lot of unknown. This is work that takes a while to collect, but we have a 73% vaccination rate right now amongst our uninsured patients, 6% declined rate, and about a 20% that's still unknown. So we are cautiously optimistic because we do not believe that 20% is wholly declines, that we are at minimum somewhere in the high 70s, and we hope that it's further than that, but we'll keep folks updated.
And Kara, just remind me, your age group primarily in there, there's a good number of folks in their 40s and 50s, right?
Our median age is in their 40s. Our enrollment ranges from 18 to 88, I think, 92. But primarily what we're talking about is working adults in their 30s, 40s, and 50s. That's really the greatest component of our enrollment.
Adam, from our vaccine, we can get age groups and look at that too, because I do think one of the areas for connections that we're all trying to do better is between 20 and 40 years old. So maybe we can, that's part of the focus group work and some of the other work. So I just wanted to, if anyone has, that on their mind and has some data points, we can get into that a little bit deeper with engagement.
Hey, I want to say to everybody, thank you. We're 10 minutes past our close, but what a great 10 minutes that was. If I think back about the last hour and 3/4, we've done this tactical work to promote vaccine in what we're doing today and tomorrow and understanding where we need to focus. We've gotten in terms of medium-term strategy, we're aware that we need to be doing some preparation for survey and focus group work with our constituents to make sure that the health plan priorities for DuPage County represent the visible and recognized communities and diversity that's here. We've learned about the hesitancy in a real granular way from focus group activity. We'll get some more information from Mimi about that, and we're primed to be able to take that information into town hall meetings. And we've had a very excellent strategic conversation about data and census and setting strategic direction for us for the long term. Thanks so much for your participation today. And I look forward, we don't have a date set for our next meeting. So I look forward, we'll stay tuned on that area.
Yeah, and Dave, part of that is us making sure that we have enough support on the date so that we can do that forces of change assessment really adequately. So as soon as we have that date, we'll send it out so you have plenty of notice. Thank you.
Hey, thanks so much, everybody. Be safe.
Thank you.
Thanks, everyone.
Thank you.